Good afternoon. Today's Battle Rhythm, Combating Veterans Homelessness, will be hosted by Jeanette Gillis. Jeanette is the Deputy Director of Community Integration at America's Warrior Partnership. She is also the lead for America's Warrior Partnerships Network, which provides local veterans serving organizations with a connection to national resources when a veteran's request cannot be met locally. To find out more about the network, please visit americaswarriorpartnership.org/the-network. That's it for me. Jeanette, the floor is yours.
Good afternoon, everyone. Thank you for joining us. I would like to welcome all of our America's Warrior Partnership affiliate communities, Four-Star Alliance members, veteran service organizations, and guests that are joining us. Thank you so much for being here. We'd like to let you know that our guests today are Roger Casey. Roger is the Director of Education and Dissemination for the VA National Center on Homelessness Among Veterans. We also have Shawn Liu. Shawn is the Community Engagement Coordinator at the VHA Homeless Programs Office. And they are joined by Brooke Pendleton, and Brooke is the HCHV Coordinated Entry Specialist at the Central Virginia VA Healthcare System. So we've got some wonderful folks here today that are going to share their expertise with you. And our first speaker is Roger Casey. And so, Roger, I would like to turn it over to you.
Great. I just want to say hello. Thank you for joining us. My name is Roger Casey and work for the VA National Center on Homelessness Among Veterans. And I think, Shawn, you're going to lead us off, aren't you?
Yeah, thanks, Roger. Thanks, Allison. No, really excited to be here with everybody today. Roger, my fellow Floridian, dear friend and colleague, here to chat with you about different ways that we are combating veteran homelessness. So really excited to talk about the work that we get to do on a daily. All right, so we recognize that there's probably a wide range of folks on this particular call. So we've broken this up both in terms of some foundational information, a little bit about how we're doing on the road to ending veteran homelessness across the country, and then getting into the latest and greatest for those who might be a little bit more familiar. We know there's going to be some breakout time at the end. So in lieu of that Q&A, we'll probably touch some of your questions during our kind of breakout session. If you are new to homeless services, we're going to talk a little bit about some of the kind of the fundamentals so that we're on the same page, a little bit of level setting. Usually I like to start off with definitions, nouns and verbs, so we can kind of be on the same page of what we're talking about. So what do we mean when we say a homeless veteran? Well, when we're talking about homeless, that adjective, we're really talking about a person who lacks a fixed, regular, and adequate nighttime residence. For those who are familiar, this is straight up from the HUD's definition from the McKinney-Vento Act. And usually homelessness falls into two categories: sheltered homelessness, which is usually literal shelters, transitional housing programs. During the pandemic, we've made fantastic use of hotels and safe havens as well. Or unsheltered homelessness, which is literally out on the streets, in forests and encampments, where there's no actual shelter. I want to kind of acknowledge that for women and families with minor children, their experience of homelessness may be a little bit broader here, using more kind of doubled up or couch surfing circumstances. And I also want to acknowledge out of the gate that that may have implications for service eligibility. A lot of times as well, we also focus on what we call chronic homelessness. So these are people who've been homeless for not only a very long time, but usually have some kind of disabling condition, physical, mental, or substance use. And want to acknowledge that chronic homelessness can manifest both in individuals as well as families. And then finally, for the concept of a veteran, we actually have a pretty broad definition. We're taking this out of the essentially, we're going to get into kind of the formal definitions and milestones of ending veteran homelessness called the criterion benchmarks. I'm going to get to that in a couple of the slides. But this particular definition we're going off of is an adult who've served active duty in the armed forces, including persons who've served active duty from military reserves or the National Guards, and regardless of the discharge that they received, acknowledging that this really broad definition may have implications as well for service eligibility, right? So when we think about ending veteran homelessness, we are having this very broad definition. We're capturing a wide net of veterans. I'm going to talk a little bit about some of the progress, how we've been doing so far in our efforts to end veteran homelessness nationwide. You should know that generally speaking, our work is working. And since 2010, we've seen nearly a 50% reduction in veteran homelessness across the country. This is a really, really huge accomplishment, somewhat unprecedented in the history of the country, which is fantastic. But we also recognize that near 50% is not 50% and it's not 100%. So we still have much more work to do. You should also know that when we bandy around this term, ending veteran homelessness, that we're not just doing kind of like a talking point or doing some weird kind of government gobbledygook. We actually, there's something very concrete that we mean when we say we're ending veteran homelessness. Want to also kind of start and acknowledge what we're not saying. We're not saying that no veteran will ever experience a housing crisis again. We're not saying that. I don't have a magic wand. Like if I had a magic wand and I actually housed every veteran experiencing homelessness across the country, everybody here knows what will probably happen tomorrow. We'll fall into homelessness. Well, knows what will happen the next day and the day after that and the day after that. Right. So acknowledge that even if we can house every veteran today, there are still just parts of the way that our kind of civilization works that people will still experience housing crises. But what we are talking about is that an end to veteran homelessness means that every community across the country has a systematic response in place that ensures that homelessness is prevented whenever it's possible, or that if veterans do fall into homelessness, that their experience is rare, brief, and non-reoccurring. It doesn't happen very often. It's only for a short amount of time, and it's just that one time in their life. The other thing that I want to acknowledge is that as we go through this journey of ending veteran homelessness together as a country, what we also recognize is that we're doing a lot of work here, but that achieving essentially this milestone of achieving an effective end to veteran homelessness is just the beginning. So for any of them out there who are like saying, oh, we're working ourselves out of a job, we're not working ourselves out of a job. And here's why. Sustaining those systems, making sure our community's responses are still fantastic for veterans who will continue to experience housing crises, that's actually just as hard, if not harder, than meeting the milestones. So there is still plenty of work to do, even when we've achieved an effective end to veteran homelessness across the country. All right. You should also know that we actually have operationalized this concept of achieving an effective end to veteran homelessness. Now, my colleague Brooke Pendleton is going to talk about a different milestone, functional zero, and we'll kind of get into a little bit about what those differences. But for right now, for this particular segment of the presentation, I want to talk about something called the criteria and benchmarks, which are essentially how we as the federal government, an interagency effort, I might add, between us at VA, our friends and colleagues over at the Department of Housing and Urban Development, and our friends and colleagues at the United States Interagency Council on Homelessness. This is how we define an effective end to veteran homelessness. We have our criteria and benchmarks. Now, the criteria and benchmarks are essentially two different components that actually are essentially a milestone that when communities meet that, they've achieved an effective end. The criteria are essential community elements to their response. And the benchmarks are essentially how they demonstrate achieving that end through data. So what we'll see here is that the criteria goes into stuff that we all kind of recognize that are important on the face of it to ending veteran homelessness. Number one, do you know everybody? Number two, can you provide shelter for everybody who wants it? Number 4 and 5, can you actually house people quickly? And of course, with the benchmarks, when you get to benchmark A, B, C, and D, they're basically, can you show with data that you're actually doing the thing, that you've ended chronic homelessness, that there are no long-term homeless veterans in your community, that you can house veterans quickly, that you have enough permanent housing to house everybody, and that you uphold the principles of housing first through data. As I mentioned, you should know this is working. This is not something that we just threw out there and it's a pie in the sky. No, 82 communities and 3 whole states have achieved an effective end to veteran homelessness. This is huge, huge, huge stuff. And we're excited for more communities to actually meet these criteria and benchmarks and achieve more effective ends to veteran homelessness, so that this particular map here is going to get lit up with all of these little blue stars all across the country. All right, let's talk about, again, if you're kind of new to this particular space, it's just a really, really super high level overview of the resources, the tools that we have at our disposal to end veteran homelessness. You should know at VA, we actually have services that help address veteran homelessness and housing instability across a very, very large spectrum of the homelessness and housing instability experience, from upstream prevention efforts to some of you who are a little bit more experienced may be familiar with diversion as a new concept or a rapid resolution. And then when veterans actually enter or fall into homelessness, as unfortunate as it is, we do have services that provide not only emergency shelter, emergency housing, transitional housing, also permanent housing, getting them back into their own homes, back into their own apartments, but also providing supportive services to make sure that those housing placements stick. All right, this is kind of like the myriad, the continuum of services that we have. And you can see they kind of run the gamut from outreach, engagement, and referral way upstream to really assessing veterans when they enter into homelessness. Residential services, providing emergency and transitional resources, our permanent housing services, and of course, some of our specialty services as well, recognizing that justice involvement is a huge kind of predictor for homelessness experience, and also recognizing the importance that employment can play in housing stability going forward. All right, now for those who this was kind of the old news, Shawn, you're familiar with this already? Great, let's get about the new and latest and greatest program updates that we're excited to talk about. All right, big one. This is really, really huge. Recently, the National Defense Authorization Act of 2021 expanded the HUD-VASH program's eligibility, broadening the concept of veteran. Some of you may know previously that in order to be eligible for the HUD-VASH program, you had to be eligible. Yeah, no, right. Yeah, in the chat. You had to be eligible for VHA healthcare services. Now, this made sense because the HUD-VASH program provides a lot of wraparound services, as it specifically was meant to target those chronically homeless or vulnerable veterans. But what we also recognize and what we've learned in the last, 21 years of doing this work is that there are a lot of veterans out there who need that level of care, but because of the circumstances that probably unsurprisingly have led to their homelessness and the long-term homelessness, aren't eligible for VHA healthcare services, right? So there was this kind of disconnect between the needs of veterans in our communities and the services that we can provide. No more, we now have this expanded eligibility. I'm going to butcher the eligibility because it's not quite the same as, for those in the know, it's not quite the same as HUD-VASH is now the same eligibility as SSVF or GPD. I will kind of acknowledge what we're learning the more that we dive into it with our Health Eligibility Center, with their Office of General Counsel, is that it's actually really, really complex to figure it out. The good news that you should know is that this authorization is live now. Even though we're still trying to figure out how to actually implement it, it actually is live now. We actually do have some medical centers across the country who are admitting HUD-VASH veterans using this expanded eligibility. So fantastic news all around. Okay, next up, one of the things that we're always mindful of is making sure that our services are responsive to the ever-changing needs and diverse needs of the veterans that we serve. This means a variety of things to making sure that our services are accessible and responsive to veterans from racial or ethnic minorities, who are open to transgender veterans, to LGBTQ veterans. But also one of the things that we recognize is making sure that our services are responsive to our aging veterans. Now, one of the things that is causing us a little bit of heartache, a little bit of angina, is essentially what we're seeing in our data as an aging veteran cohort, a group of veterans that are taking up a bulk load of the work that we're doing that are kind of aging along with us. So many of you probably remembered at the start of OEF, OIF, O&D, we were very, very concerned about younger veterans and this wave of young veterans entering into homelessness. That really didn't happen. But what we are seeing are veterans getting older and older and older, and thus needing more enhanced services that, to be quite frank, our services were never really designed to provide. So one of the things that we're really, really excited about is not only our National HUD-VASH program office, but very, very forward-thinking VA medical centers across the country are doing these interesting partnerships with our geriatrics and extended care, as well as our public housing authorities, to essentially provide HUD-VASH that is more responsive to aging veterans, specifically using these different types of models, such as medical foster home, assisted living, adult care homes, and community residential care. I'm hoping that you're going to get a copy of these slides. You'll actually see a link to a blog that we wrote about one of the very, very first veterans who benefited from one of these interesting new pilots to really, really provide supports for aging veterans. We think this is a fantastic thing. All things being equal, many veterans who do need nursing home or assisted living facility level care, they may not necessarily be able to afford it. They may also not necessarily get the kinds of wraparound services that our HUD-VASH program can provide. So if we're able to provide these really, really intense wraparound services while also providing enough supports that our veterans can, this is an important term, age in place, age in their own homes, that's going to be fantastic. So really, really excited about this. We're trying to get the word out. Literally, one of the things that I'm going to take a little break after this presentation, I'm going to hop off, talk to the HUD-VASH team. We're really, really trying to promote this across the country, not only so that more veterans can benefit, but also more HUD-VASH programs or medical centers will adopt these innovative practices and get them going. So more to come on that as well. Okay, last up in the new latest and greatest, I don't know if you're familiar, probably have a lot of community providers on the call, SSVF, Supportive Services for Veterans Families, and the Shalow Subsidy Initiative, that got expanded. So some of you may not know about what Shalow Subsidy is. Shalow Subsidy is basically an opportunity where SSVF goes in and covers 35% of certain eligible veterans' rent for 2 years. Now, the beautiful thing about this Shalow subsidy is that it actually just stays at 35% of the veterans' rent, regardless of if the veteran's income increases or decreases. So it actually incentivizes employment as well. So many of you are probably familiar, the Centers for Disease Control and Prevention's eviction moratorium, it ended, yikes. We do have VA are part of kind of like the federal government's all-out push to make renters and landlords aware of the unprecedented amount of resources that are available to pay all the past due rent that a lot of renters owe due to the pandemic and due to the economic hardships of the pandemic. But one of the things that we recognize is that even if you pay off all of that past due rent, that doesn't necessarily mean the place that they're in is still affordable today. So this Shalow subsidy initiative is really critically important. The thing that we're excited to let you know is that last month, we expanded what was essentially a smallish pilot to essentially basically every county in the entire country in all of our areas, including DC, Puerto Rico, US Virgin Islands, and Guam. We have a presence in Guam. So this is going to be huge. Money is sending out to grantees now. We're really, really excited about this as we get this up and running in the next couple months. It's going to help out a lot of people. Okay. That is essentially the latest and greatest. Before I turn it over to Roger to talk about some of the education and helpful resources, education resources that are on offer at the National Center on Homelessness Among Veterans, I just want to leave you with some helpful resources, whether you're familiar, you have some veterans that you want to help, you might be a service provider yourself. First and foremost, if you know any veterans who are in need, but you don't know how to get them connected to the VA, we encourage you to give them this number. This is the National Call Center for Homeless Veterans, 1-877-424-3838, 24/7. It's available. If you know a veteran who's homeless or experiencing housing instability, this is a great, great first step to get them connected to. Next up, if you're a service provider and you need to figure out veterans eligibility, I listed up a whole lot of programs. And I don't expect any of you to become experts in veteran eligibility. A great resource, this is a hyperlink, that little blue right there, Squares. Squares is a website where we can actually get real-time veteran eligibility information for all of our homeless programs right at the touch of your fingertips. Just type in the veterans information and you get going. There's a little bit that's involved in terms of developing getting a sign up for a user login so that you can actually access this tool, but it's a fantastic tool. You want to know more information, check it out in the hyperlink in these particular slides. And last but not least, want to let you know that if you have veterans who are in need or struggling, whether they're homeless or experiencing a housing crisis due to the CDC's eviction moratorium ending, we encourage you to also check out va.gov/housing resources. This is our one-stop shop for all of the resources that not only from VA, but just our general resources to help people avoid eviction and avoid homelessness. Again, va.gov/housing resources. Connect them to this webpage. It's got a lot of great stuff. Okay, with that, I'm going to shut off my camera and hand it over to my friend and colleague, Roger, to talk about some of our educational resources. Roger?
I like your animation. You can, when you're at Squares, you can just type it in. Yeah, I like that. Just real quick, the National Center on Homelessness Among Veterans was essentially created in 2009 in response to our Secretary Shinseki pronouncing that he wanted to end homelessness among veterans. But up till that time, there wasn't a lot of research that was being done. There was limited information on practice models, and the education that our homeless program staff and providers had wasn't quite organized in the way that we've accomplished over the last couple of years. So the National Center hopes to put those things together. We have a pretty good website, some great researchers, and we work with Sabrina Posey, our coordinator of education, and Derek Crowley. We have some great folks in our education corps. So yeah, the legislative intent of the center was to promote and conduct research, identify best practices, integrate those best practices and evidence-based practices, and serve as a resource center. And again, we have a education corps, and what this education corps is tasked to do is to provide education and training and technical assistance. We actually have a great method to determine those knowledge gaps, educational gaps, and we create national and local events for our staff, but our providers, our non-VA staff, and it's important for us to recognize that they, if not more than VA, see our veterans on a day-to-day basis. So we like to provide the information to help them accomplish their tasks. So we are providing here the last 2 years of our archived trainings, and I will also provide 2020, and we have some really great trainings and podcasts and webinars for 2021. So this may look like it's overwhelming, but I hope that these links work when you download the slides. And please feel free to look at all of them, some of them, whatever you think may be of interest to you, but also pass along to your staff. We have presentations on subject matter experts, and a lot of these subject matter experts are from VA, but also our community providers. Trauma-informed approach. We have an overview of motivational interviewing. We've done a lot of work on racial disparities, how to construct and think about a program that recognizes all veterans despite race, creed, color. And I think we have our podcast list. Yeah, I think we have our podcast listed on here too. For 2020, we looked at gambling, which is considered an addiction. We also have some webinars on integrating data. You can see them here, establishing an environment for homeless housing centers of what we learned from COVID-19 and suicide. I don't need to read all of these, but last month, we talked about housing first and what that means. Where are we on housing first, and how different programs have interpreted housing first, but also applying housing first principles. We are recording that this month, and we should have that link available, and we'll get that out to you guys. Here's our contacts: National Center on Homelessness Among Veterans. There's our website, Derek Crowley, Sabrina Posey, who I think is on our call today, and myself. Please feel free to get in touch with us. And I'll pass it over to Brooke.
Good afternoon. My name is Brooke Pendleton. I am the coordinated entry specialist for the homeless team at the Richmond VA Medical Center. And today I'm going to be discussing Functional Zero. And my job is to work with other community organizations and to help reduce the number of homelessness in our community. And so working with different COCs, supportive services for veteran families, nonprofits, and homeless shelters. So Shawn already went through the criteria and benchmarks. So that's just different approaches to measuring homelessness. So there's a federal criteria and benchmarks for achieving the goal of ending veteran homelessness. And then there's also functional zero. So functional zero is when the number of actively homeless veterans is less than the average monthly housing placements. And I have a better picture to go over that here. Through this, you can see like number of veterans experiencing homelessness, 16, and then the average housing placement 4. So they haven't hit functional homelessness yet. But then once we get to June, it's 3 people experiencing homelessness, 3 veterans experiencing homelessness, and then the average housing placement is 3.2. So at this point, they have reached functional zero. And so then steps for achieving functional zero: buy-in from the COC, developing a coordinated entry system, case conferencing, creating a by name list, reviewing data, trying new ideas, and staying optimistic. The continuum of care is pretty much a local body that coordinates housing and services for homeless families and individuals, nonprofit providers, state and local governments to quickly rehouse homeless individuals and families while minimizing the trauma, dislocation caused to homeless individuals and families. And so it's a big governing body. With that, they've created a coordinated entry system, and the coordinated entry system is an approach to coordinate and management of a crisis response system that allows us to make decisions from available information to efficiently and effectively connect people to housing and service interventions that will rapidly end their homelessness. So each region pretty much has one like that I work in. I know for my catchment area, I work with 4 different COCs. So to get to functional homeless, we have case conferencing, and it's a reoccurring problem-solving meeting with key participants. So it'd be shelter staff, people from the Department of Social Services, the Public Housing Authority, Department on Aging, supportive services for veteran families, nonprofits, the VA social workers. We also have landlords, individuals with lived experience, and employment providers. And the discussion goes around what are the veterans' housing barriers? What housing resources are available? What's the best match for the veteran to which housing resource? We also discuss next steps, like if a veteran needs to get an ID, that would be the next step towards housing, or if a veteran needs help with their housing search, that could be a next step. A next step could be signing a lease or even having an inspection done on the house or the apartment. We also discuss housing target dates. So once someone enters our system, like we want to have an idea of like when they'll be exiting the system, and that we want to make it as soon as possible, but we also try to be realistic. Like some people might just need a security deposit, while others might need help getting income or applying for benefits. And so during these meetings, we go over the by name list, which is a real-time, up-to-date list that identifies all the individuals for a particular homeless subpopulation within the community. So I know the print is small, so we have like the veteran's first name, last name, HMIS number. Are they VA healthcare eligible? Are they SSVF eligible? Do they have any income? What's their barriers? So these are the types of things that we put on the list. So then during the meetings, we usually have this list displayed so we can go down line by line, and we might have to add new barriers or add new information if their phone number changes, like, because it's very important to know how we get in contact with the veteran. And then we go line by line to see what can we do next. So one of the columns would be like a next step. And then, so if I say I'm going to help this veteran apply for Social Security by next week, and then for the next meeting, like I better explain how I help that veteran apply for Social Security, because that's what I said I was going to do. So these case conferencing meetings, they give the provider some accountability. Like if you said you're going to help the veteran in this way, like let's see like if you really did help the veteran in that way. It also gives us an opportunity to advocate for our veteran. If you think like their best housing resource would be permanent supportive housing, but someone else thinks that they benefit from supportive services for veteran family. That allows an open discussion with the group on, well, what resources need to be in place if they don't have permanent supportive housing. So the case conference really gives all the providers an opportunity to show their strengths and what they can do so we can all help this veteran with their housing and achieve housing and be able to sustain it. And so sustaining functional zero, we monitor the inflow and outflow, like how many veterans are entering the system per month and how many are getting housed. We have target system improvements or changes like accelerated housing placements. If we've noticed someone's the average time on the by name list is like 183 days. How can we decrease the amount of time that veterans are staying on the by name list? Or if we've noticed that the veterans average stay in the GPD transitional housing program is 9 months, how can we decrease that? A lot of the accelerated housing placements come from engaging landlords. So what are we doing to engage with landlords? And we might try different ideas like inviting landlords to the case conferencing group. And then, that might work for a couple of weeks and then landlords stop coming after a couple of weeks. So then we regroup and say, okay, well, that tactic didn't work. Like, what can we do instead to engage landlords? And so it's all about trying new ideas, testing them out. And if that doesn't work, seeing what else can work. And I know I went through that pretty quickly, but so that's the information I have. And these are some websites that I think will be available. I also put in the number to get in contact with the Healthcare for Homeless team if you know a veteran who's experiencing a housing crisis. Thank you.
Great. So we have 2 questions in the chat. One of them is, what is the typical timeline for getting a veteran housing through the VA?
I think that depends on the VA and what resources they have available in that continuum of care. Yeah, I think that's the fairest response to that. We try to get everyone housed at least within 30 days. That doesn't always happen. So it's like 30 to 90 days.
Okay, thank you. And the second one came from Allison, and I think she was curious about how often your group meets. So the group that goes over the buy list and talks about the different cases, how often does that group meet?
So it depends on how many people we have on the by name list. Like for one of the COCs I work in, there's like over 100 people on the by name list. So we meet weekly. Another COC I work in, there's about 30 veterans on the by name list. So we meet monthly, but we send each other updates every week.
So it really just depends on the COC and depends on how many veterans are homeless in that community at that particular time.
Yes, ma'am.
Okay. All right. Does anyone have any other questions for Brooke?
Hey, Brooke, this is Allison. Hey, who are your key group people that meet with you?
For the case conferencing?
Yes.
Okay, so the coordinated entry specialist from the VA, we also have shelter staff, Department of Social Services. We have someone from a local food bank come, someone from Adult Protective Services, people from property managers from different apartment complexes. So it's like a whole community of people that come to discuss the veteran. Oh, and employment specialists, we have an employment specialist on the homeless team, and she comes to case conferencing in case there's a veteran interested in employment. So then she gets a direct referral right there. A lot of times it's for direct referrals. Like if I'm working with someone and they need to apply for SNAP, it's a lot easier to just direct them to Department of Social Services because there's someone there at the table rather than having to call over there and send a referral via fax or email.
Brooke, what would you say if you were in a community and you were trying to do what you guys have done and reach functional zero? What would be one tip that you might say it would be a really good thing for them to do?
A tip is to stay open to new ideas and be consistent. Sometimes with the turnover in homeless services, we have new people coming from the same agency. So I think turnover happens, but to have the same people come so they're aware of what's going on with the veteran. I think getting the social worker, case manager's point of view on what's going on with the veteran is very, very important to getting them matched with the most appropriate housing resource. And we have very open conversations. Not everyone agrees all the time. Sometimes it can get a little heated, but that's what's important to try to foster a good solution to the problem, is that we have to be honest about our opinion and advocate if we think our veteran needs something. So consistency with the meetings. Sometimes people are like, oh no, like not another meeting, like I'm so zoomed out. But you know, it's important to keep going to the meetings and keep working on ending veteran homelessness.
Right. I know everybody is particularly zoomed out, but that is a key to, like, to hear you say that, you know, keep the consistency going, keep everybody coming to the meeting. We've had another person say, make a suggestion to please include the disabled veteran outreach specialist to the groups. So that's just, you know, she's saying that from her point of view. And also another person said conflict equals growth. And that is an important point that you made. It is not always easygoing sometimes. It's not like swimming downstream. Sometimes you feel like you're swimming upstream, but it is always hard work to do, but it can be done. And programs like you and your community show that we can reach functional zero, especially with the support and help of programs out there like what the VA offers. Let's see.
We have another person. We have someone raising their hand.
Yeah, hi, hi, my name is Victor. I actually work for an SSVF program, Support Services for Veteran Families program in Santa Barbara County with New Beginnings Counseling Center. And so just to kind of piggyback off of what was being said about the meetings, you know, it's really important to like have those meetings. And what we do here in Santa Barbara County, as far as veterans, you know, homeless veterans goes, we have our coordinated entry meetings, you know, bi-monthly. And then on, you know, those opposite weeks, we have veteran specific case conferencing, which is, you know, obviously more specific to veterans. And in either one of those meetings, we get referred veterans from, you know, that haven't been connected to any kind of veteran services. And so we have VASH on the call. We have, you know, one of their social workers, and then they also have like their coordinated entry specialist on the call. And sometimes they'll have their housing navigator on the call as well. And then we have all the SSVF providers that serve the area, to include all the other homeless service providers that are in the COC on both of the meetings, that especially if they work with veterans for the veteran specific case conferencing. In addition to that, we also do a monthly meeting where it's the SSVF providers, VASH, and GPD. And GPD is the grant per diem program within shelters that the VA pays or helps allow for veterans to stay for a longer period of time while they seek housing. And so the three of our programs get together, and then we do a more, you know, specific case conferencing, where we either make referrals, check up on referrals, find out what the status is on, you know, their voucher, their housing, you know, if anybody's going to be coming down the line, to keep an eye out for. And we also give each other background information on a veteran that maybe the other hasn't worked with before. And so that's very helpful. And then I'm also on the Veterans Collaborative Board for Santa Barbara County. And we also do working groups for homeless veterans. And that's something that, you know, it includes service providers if they want to, people from the COC, coordinated entry system, to include any outside, you know, quote unquote civilian, you know, individuals that are interested in, you know, trying to solve solutions to end the homelessness problem within Santa Barbara County. So those are just some additional like meetings and stuff that we do here in Santa Barbara County. But I mean, the more meetings, the better. The more not just individuals, but agencies you can have working collaboratively together, especially with like public housing and, you know, just anybody outside of the area that may have some kind of connection or resource is always very, very helpful. I just wanted to add that.
Thank you. Thank you for that contribution, Victor. We really appreciate it. Right now, we're going to go into our breakout activity. So I'm going to turn that over to Allison for that. Thank you so much, Allison. And we're going to get into our...
Yes, thanks, Jeanette. So for the next 20 minutes, we're going to go in breakout groups. In a few minutes, I'm going to open up the breakout rooms for your collaboration conversation. When the rooms are open, you will be able to self-select a topic and go to that room. So today's topics are VA housing resource discussion. That's going to be led by Roger and Shawn. Functional zero discussion. That's going to be led by Brooke. If you want some more ideas, and if you're from the community and you're working on that, you guys can collaborate with good talk. Fundamentals of housing resources. That's going to be led by Jeanette Gillis. This is for people who are really new to this whole idea of housing information, and maybe that's not part of your job. We are providing this group just to kind of catch you up and give you some basic information. Also, a rural housing conversation. Rural housing is difficult. Kenneth Thompson from Panhandle Warrior Partnership has agreed to lead that group. I'm going to go ahead and open up the rooms. If you have trouble, just stay on the phone line with me and I'll get you sorted out. Thanks. Here we go. I think we've got everybody back. Let's hear from group. We're looking for a key takeaway. See, from group one. Who would like to present from group one?
I will be presenting from group one. So our group was the expanded VA resources, and our key takeaways was the drawbacks in limbo right now for a lot of organizations, like the Stanford Act being lifted. A lot of places are having trouble with trying to navigate what they should do, how they should move. Eviction moratoriums, I think I'm pronouncing that right, in different states. You know, some states are still abiding by that. Some states are lifting those as well. And then we also talked about other services that the VA could provide on top of helping combat veteran homelessness, like helping with substance use, employment, because sometimes all of those things go hand in hand. So those are some of the key takeaways.
Thank you, Chelsea. Okay, let's see. How about group number two? That was functional zero discussion.
Hi, I'll go ahead and share. There was a little difficulty at first because I couldn't get my speakers to work. But so for our group, we discussed what's needed to get to functional zero, what steps did we take in the beginning, and the importance of having a by name list. So then it's better to keep track of how long the veterans are staying on the by name list. And when you see someone's name stay on there a long time, you know that's the person that like you guys really need to discuss, like what's going on with this veteran. So just the importance of the by name list being a major component.
Excellent. Yeah, that sounds like a great, being able to have that list to be able to check back by, and I think also the keeping people accountable for what they say, what you talked about earlier. Let's see, group number three, topic number three, fundamental of housing resources.
Fundamentals, we talked about SSVF and the importance of connecting to the SSVF program in your community when you're working with veterans. We also talked about the importance of having a holistic case manager and how sometimes veterans can be working with a number of different programs. And one of the other things we talked about is that sometimes the resources can exist, but connecting people to them can be a challenge. And also places where there aren't actually houses for them to be living in. Yeah, for sure. That sounds like a good segue to topic number 4, which was a really hard one with Kenneth Thompson from Panhandle, was rural housing conversations. Kenneth?
Yeah, so we pretty much had a discussion to where some of the challenges when it came to rural, housing and, just speaking about landlords, finding community partners, but also, making sure you have caseworkers that are able to, not gonna say adjust, but able to not just see it a standard way. This is how you case manage it. You have to go by the book or this way. You just got to think outside the box when you're living in and working in rural areas. And it really just comes down to just staying consistent, but also creating those relationships with landlords or community partners, and also just looking at it from a standpoint of everybody's affected right now, of course with COVID, but also, other factors when it pertains to rural areas, you can't blame them, but at the same time, you would think it would be better because we're talking about veterans that serve the country. Landlords are looking like who's going to pay the most, who's going to pay it first. So you got to kind of be, one of those ones that speak it and talk to them and try to convince them, different things like that. So, it's all a struggle, but really, I guess the gist of the conversation is just ongoing. You just got to keep trying. If it's going to help one vet, one family, that we pretty much did our job.
Absolutely. That's a good point. And it takes the community, as it does. Jeanette, I appreciate you guys all doing the breakouts and being sharing a part of that information. Jeanette, I'm going to turn the presentation back over to you to close us out.
Thank you, Allison. I would like to thank you all for being with us today. I'd like to invite you to register for our AWP's 8th Annual Warrior Community Integration Symposium. It'll be held October 25th through the 27th. This event will be a 100% virtual experience, and we hope to have you in attendance for this event. Thanks to all of our sponsors, the registration is free for all participants. So if you're interested, register today for 3 full days of networking, workshops, interactive experiences, breakout sessions, and general convening about how you can be a part of the solution when it comes to our nation's veterans, families, and caregivers. To be a part of the symposium, visit www.americaswarriorpartnership.org/symposium for more information and a link to register. Thank you all for being here. At America's Warrior Partnership, we empower communities to empower veterans, and we hope that we provided you with an opportunity to do that today. We believe our communities are best equipped to provide a quality of life for our veterans, and our goal here is to provide community partners like yourself with the support that you need to help deliver a quality service. We invite you to be at our next Battle Rhythm, October 4th. The topic will be upstream approaches to suicide prevention. Thank you so much, and we hope you have a great rest of your day.
Have a great day, everybody.